In this video, we'll be seeing about the blood supply, lymphatic drainage, and the nerve supply of the thyroid gland. So, please stay connected. Now, we're going to start with the arterial supply of the thyroid gland. So, arterial supply of the thyroid gland is quite very important because it has very rich blood supply. Now, it is actually supplied by three important arteries, that is a superior thyroid artery, inferior thyroid artery, thyroidema artery, and some accessory arteries. So we'll be seeing about these arteries in detail. So this picture is more than sufficient for explaining. When you're studying anatomy, please study with the picture because it will be very helpful for you to remember things. Now, we are going to see about the superior thyroid artery. So, when you see about the superior thyroid artery, you can see from the label itself where the superior thyroid artery is there. So, this is superior thyroid artery. It is usually arising from the external jugular vein. This is the external jugular vein, which is a branch from the external carotid artery, not external jugular vein, external carotid artery, which is a branch from the common carotid artery. Common carotid artery is again a branch from the arch of aorta. So it is, as you can see very clearly, it is. So we are going to study about the course of the superior thyroid artery. So it is branch from the external carotid artery, and it is running downwards and nearly to the apex of the thyroid lobe. It is dividing into two branches, that is anterior and posterior branches. So anterior branch, you can see the anterior branch very clearly. The anterior branch is running downwards to the anterior border of the thyroid lobe. So this anterior branch running towards the anterior border of the thyroid lobe, and it is curving medially to move into the upper border of the isthmus and getting anastomosis between the other part of the anterior branch of the superior thyroid artery. So you can see the isthmus here, anastomosis here. You can see the anastomosis here, right? Now this is about the superior thyroid anterior branch of the superior thyroid artery. So now we are going to see about the posterior branch of the superior thyroid artery. Posterior branch is also dividing from the apex, from the superior thyroid artery at the level of the apex of the thyroid lobe, and it is going into the posterior border, going along the posterior border, and it's anastomosing with the inferior thyroid artery. So this is the course. So when you're seeing about the supply, so superior thyroid artery, nearly it is supplying the upper one third of the gland, and it's also supplying the upper part of the isthmus, right? Now this is the isthmus part. So as you can see very clearly, this is the isthmus part. So for further details about the thyroid gland, please check on my video about the thyroid gland that I have made, about the features, about the relations of each lobes and everything. Please go and check onto that video before seeing the blood supply only, then it will be very easy for you to learn this. Now we are going to see about the inferior thyroid artery. So what is the cause of the inferior thyroid artery? You can just see from the pictures. So it is a branch from the first part of the subclavian artery, and it runs upwards and then medially and then it crosses this recurrent laryngeal nerve very nearly. So you can see this is the recurrent laryngeal nerve. It crosses them anteriorly or posteriorly, it depends sometimes. It crosses the recurrent laryngeal nerve and then enters the thyroid lobe on its posterior border. So once it comes to its posterior border, it then moves upwards. So and anastomosing with the posterior branch of the superior thyroid artery. So this is about the inferior thyroid artery, and it also gives another branches also. So one of the branches only goes and gets anastomosis here, but there are another branches also for this inferior thyroid artery. So as you say, this is a so it is supplying the lower 2/3 of the thyroid gland and also the inferior part of the isthmus. So this is about the blood supply of the inferior thyroid artery. Now again one more small artery is there, that is the thyroideema artery. So thyroideema artery is a branch arising from the brachiocephalic trunk. This is a brachiocephalic trunk. This is a small artery arising from the brachiocephalic trunk, and it is supplying the lower part of the isthmus. As you can see, it is supplying lower part of the isthmus. So it also arises sometimes from the aorta, arch of the aorta. So from here also it may arise sometimes. So it depends. Now this is not a very must artery. That means it is present only in 30% cases, not for everyone. Like only 30% cases this artery is present. Now about the accessory thyroid arteries. So accessory thyroid arteries are nothing but, you can see in this in picture, they are just the arteries which are arising from the trachea and the esophagus and supplying the thyroid gland. So that is about the accessory thyroid arteries. So now we are going to see about the venous drainage. Venous drainage is very simple when compared to the arterial supply. So when you're seeing about the venous drainage, there is three kind of vein. So there are three kinds of vein here. So the superior thyroid vein, as you can see, middle thyroid vein and inferior thyroid vein. So there is sometimes an abnormal vein also, that is called as Koch's vein. Okay, so we'll see about all these vein in detail. So when you're seeing about this superior thyroid vein, it is collecting the blood from the apex of the thyroid gland, and it's moving upwards and laterally to drain into the internal jugular vein. This is the internal jugular vein. In arterial supply, you can see everything is arising from the external carotid artery. Here you can see everything is draining into the internal jugular vein. So this is about the superior thyroid vein. It's quite simple, right? Now about the middle thyroid vein. Middle thyroid vein is also like a sinus. You can see very dilated and it's very short, and so it is actually arising from the middle part of the lobe and draining the blood into the same internal jugular vein. Now again one more inferior thyroid vein. Inferior thyroid vein is actually arising from the isthmus, lower part of the isthmus, and it is draining into the brachiocephalic vein. So in some cases there is one more vein called as thyroid vein of Koch. So Koch's vein or thyroid vein of Koch. So this vein is actually arising in between the inferior and middle thyroid vein between, and it is getting drained into the internal jugular vein. This is about the venous drainage, guys. So now we'll be seeing about the another important thing, that is a lymphatic drainage. So lymphatic drainage is quite simple. You can just write the lymphatic drainage by just seeing this picture. So see, the lymphatic drainage are two groups actually. they are actually divided into two groups, upper and lower groups. So upper and lower groups, that's all. So upper groups of thing. So upper group means upper part, lower group means lower part. Now the lymphatic vessels arising from the apex is actually draining into the pre-laryngeal lymph nodes and the jugulogastric nodes. Pre-laryngeal lymph nodes and jugulogastric nodes. And the lymphatic vessels or the lymphs, everything coming from this isthmus part is getting drained into the retrosternal or brachiocephalic nodes. And there is a group of lymph nodes surrounding this recurrent laryngeal nerve. These are already called as a nodes along the recurrent laryngeal nerve. So they actually collect the lymph from the from the base of the lobe. So this is about the lymphatic drainage. It's very simple. When you study with this picture, it is very simple. Now, one more topic is that is about the nerve supply. So nerve supply, I don't have any pictures because it's quite simple to study nerve supply. So nerve supply, you know that it is having two, that is parasympathetic supply and sympathetic supply. So parasympathetic supply is by the two nerve that we see very normally, the recurrent laryngeal nerve, and one more nerve is the vagus nerve, very familiar nerve. And another is that sympathetic supply. Sympathetic supply is by the three superior, middle and inferior cervical sympathetic ganglion, and it is mainly by the middle one. So this is about the nerve supply. It's quite easy and simple. So that's all for this video, guys. If you like this video, please like, share and subscribe to my YouTube channel Rise and Wise, so that you don't miss a video from me again. Thank you, guys.